Hello, good morning. Am I speaking to Lisa William?
Hello, yes, it is.
Hi, Lisa. Can I confirm your age, please?
53.
Thank you, Lisa. And how can I help you today, Lisa?
I wish to go on the HRT because my friend Claire, she swears by it.
Okay. Definitely, Lisa. We'll have a discussion about the HRT and see if it is suitable for you. May I check in what instance what was your thoughts about why you need to start an HRT?
I think I'm going through the menopause, and I'm, experiencing some very upsetting symptoms. So that's why.
Yeah. Could you tell a bit more about these upsetting symptoms, Lisa, to get a better understanding?
So I had hot flashes recently, and I'm working as a teacher. So it is quite a problem when I'm working, especially in front of my students in the class.
Yeah, I can understand how difficult it is to manage with these symptoms at the school. And may I know since how many days or weeks you've been having these hot flashes?
Uh, Probably something like 6 months.
Okay. And were they more in the daytime or in the nighttime?
Both, to be fair.
Mm,
Yeah,
okay.
I do get them when I'm working, and also I have like night sweats as well.
Okay. Okay, Lisa. So you did mention that few symptoms of menopause are ongoing. Apart from these hot flashes, have you developed any other symptoms that you would like to discuss today?
No, not really. I
Mm.
think yeah, this is the only problem that I've been experiencing recently.
Okay, okay, Lisa. So based on what you mentioned, you have got some ideas in your brain that you might be going on through menopause, and you did. Is there any particular thing that you're worried about these symptoms at all?
Well, I'm just worried that it will be affecting my work, and
Mm,
because I have it at night, I don't sleep very well. So it's just problematic at this stage.
yeah, I can understand. I hear that. So I can understand what you're expecting for the HRT. Apart from that, do you have any other? Are you hoping for anything else that we would like to help today in the consultation?
Not really. I would assume that that would sort out the issue here.
Yeah. Okay, so definitely we'll look into that and see how we can help. Before that, I would like to ask a bit of more questions to get a better understanding of your symptoms.
Sure.
We did mention about the hot flashes. Yes. Are you
Mm.
having any issues with mood?
No, not really. I mean, I feel irritated when it happens
Mm,
in front of the class,
yeah.
but no mood swings or anything like that.
Okay. Have you developed any kind of heart racing, like palpitations,
No, no,
any dizziness that you noticed at all? No.
no.
Okay. Um, have you noticed any skin changes, like dryness of the skin, anything like that?
Mm, no, not really.
Yeah. Okay. Um, so, may I check how are your menstrual cycles at the moment, Lisa?
I don't have it anymore.
Okay. And when was your last menstrual period, Lisa?
Year? Yeah, 1 year ago.
Okay, it was 1 year back. Yeah. Um, may I check, have you got any operations on your tummy or to your womb at all?
No, no, I've never had anything.
Okay, okay. And no, Lisa, sometimes our health can be affected with our relations as well. So, may I check how is your situation at home, Lisa?
No, I mean it's good.
Mm. May I check whom do you live with at home?
Oh, yeah, well, I live with my husband, my son,
Okay. And how old is your son, Lisa?
14.
14. Okay. Um, and how's your relationship with your husband? Everything is going well, or?
Uh, yeah, I mean, maybe I guess there was a little bit of a
Mm.
issue, experiencing some, I guess, dryness down there, so that was not
Okay.
ideal.
Yeah, yeah, I can understand it. It's not ideal. May I check how this dryness down below is affecting your relationship?
I mean, probably because I guess maybe we are not as
Mm.
intimate as often, as we
Yeah,
used to be.
Yeah, I can understand sometimes this can have an impact on the relationship. Have you noticed any abnormal discharge down below at all?
No,
No. Okay. And any history of bleeding down below now and then? No.
no, never.
Okay. So I would like to check if you got any family history of any breast cancer, or have you got any previous history of breast cancers at all?
Not that I know of. I never heard my family mention it, so
Yeah. Okay.
not sure.
Have you had any issues with your liver previously?
No.
No. I can see that you are on amlodipine for blood pressure, and you had a check 1 month back, and you're maintaining your blood pressure in a good level. I'm glad to hear that. Uh,
Yeah.
yeah. Uh, just want to double check, Lisa. May I check? Are you any contraceptive pills at the moment?
No.
No. Okay. And have you
My,
got
my,
any?
my husband had a vasectomy, so
Oh, okay. Okay.
yeah.
So, and you did mention that these symptoms have been affecting a lot at your work. How are you coping at your work, Lisa, at the moment?
Overall, okay,
Hmm.
but I mean, I can't carry on because, as I said, sometimes I have that
Hmm.
in front of the students and it becomes
Yeah.
more often. And yeah, I do find that just embarrassing because
Hmm.
I'm trying to, be in charge of the class and then to carry on with the program, and then it happens and it's just really upsetting.
Yeah. Yeah, I can understand how this is impacting your work and the family relationship, Lisa. So based on the information what you have given, Lisa, I agree with you that you have got some symptoms ongoing related to menopause. And yes, we would like to discuss about this HRT. Have you heard about this? I know that you did mention that your friend has used HRT. Have you read about it online, or have you got any more information from your friend with
Yeah,
HRT?
yeah. So I did read about the tablets
Mm.
and the gel
Yeah,
a little bit. And as I said, my friend Claire, she said that ever since she started taking it, it literally transformed her life.
yeah.
So I'm hoping that, that would also be the case if I start taking it.
Yeah, yeah, definitely, Lisa. So HRT, there are benefits that you can get rid of these menopause symptoms. It can protect your bones, and obviously it can improve your cardiovascular health as well. Yeah. But again, it comes as different forms, like as you mentioned, tablet, gel, patches. Yeah. So before prescribing you the HRT, I would like to discuss there are some risks related to the use of HRT as well. Can I discuss this with you now in terms of
Yeah, yeah, of
risks? Yeah,
course.
yeah. So as I said, any medication will come with some side effects and risks. The main side effects that you can experience with HRT is kind of a breast tenderness or kind of a stomach upset like nausea, vomiting. Some people can develop bleeding down below as well. But again, it's quite common to have this bleeding now and then in the first 3 months. But obviously, if the bleeding goes more than 3 months, you need to speak to us regarding that. Yeah. And in terms of risks, there's a small increase in the breast cancer in people using HRT. Again, I would say there's a small increase. The general risk of breast cancer in general population would be 23 in every 1,000 women. But if you use HRT, it is slightly increased to 27 in every 1,000 women. Yeah. But again, we have other things. There are modifiable factors where if you do exercise regularly, we can definitely reduce this risk down. Again, there's a small increase in risk of clots uh, in the legs or in the lungs. May I check, Lisa, have you got any clots in the lungs or legs in the past? Have you got any family history of clots at all?
No.
No. Again, the risk of clots is low. General population, 2 in 1,000 can develop clots, but if you're on HRT, it is increased slightly to 4 in 1,000. Again, there's very small increase in risk of ovarian cancer. Again, the numbers, it is 1 in 1,000. Again, it's a small increase in the risks. Uh, again, by using a patch form, we can reduce the risk of clots and we can reduce the risk of stroke. How does that sound to you, Lisa? I know I've given you a lot of information today. So I just want to check with you. What is your understanding of the risks and benefits?
I mean, I haven't read about the risks before. I mean, I'm happy to try the patch and see how it goes, I guess.
Yeah, so definitely. I will issue the patch. It comes as an estrogen form and a progesterone combination form. as you have got the womb, you did mention that you didn't had any surgery, so progesterone form helps to protect your womb from the side effects of the estrogen. Yeah. And you did mention that you've been struggling in your relationship because of the dryness down below. Yes, Lisa. So the HRT can give you some symptom relief, but I would also discuss that you can use some local measures there if you would like to try.
Okay.
Yeah. So there are some vaginal moisturizers where I can send you a prescription, so you can use it to keep the area moist. Would you like to try that as well, Lisa?
Yeah, yeah, we can try that.
Yeah. So normally when we start on HRT, we normally book a follow-up in 3 months' time to see how we are doing and to see how your symptoms have improved so that we can dose adjust the hormone levels. So I'll send the prescription to the chemist and I will also send a leaflet on how to apply these patches. Usually you should apply below the waist in a dry area of the skin. I'll book you a follow-up in 3 months' time to check how you're doing, Lisa. But as I said, Lisa, the side effects, if the breast tenderness or stomach upset or if you develop any bleeding in between, do speak to us so we can review you. Okay. Uh,
Yeah,
have you
thank
got
you.
any other questions, Lisa, today?
No.
There's a lot of good things you've done here. We will break it down. Let's hear
Mm.
it from the role player.
From Lisa's perspective, it felt very on point, very specific with the questions and like well structured. Uh, I feel that her, history at the beginning was covered, and you were very open to her needs and ask her what are her expectations and concerns. So explored the emotional part of it, and then maybe moved into risk. So overall, it really felt like it uh, was flowing naturally.
Have you found the insights in this video useful so far? If so, you might be interested in SCA Blueprint. Just click the link down the description below and sign up, and you will get a teaching from me every day for the next 7 days. In the data gathering, I think you did cover a lot, and in the chart there's quite a lot of things to cover. So that's good that you were managing to go over various things. You were checking whether it could be thyroid issues. You're checking about past medical history, whether you got any surgery, and menstrual period as well. So it's good that you've done that. I think at some points, like sometimes you do ask double question, like don't ask double barrel question, because it's not good to ask a patient one question and then the next one straight afterwards. Sometimes you might ask question like how many days or weeks you have this. Like it would be much better to just say how long do you have your period for, or
Yeah.
like how long hot flushes. Don't give this one option or two, like weeks or
Yeah.
days, or ask one or other question. Then other thing I would say here is that it's good you consider the relationship being an impact, but I don't think you have to go into so much detail about
Mm.
this because there are other things that we need covered. And with related to the work here, it could be another issue as well, that you did get the fact that she's a school teacher, so it's affecting her work. So I think you had enough to see how it's impacting her.
Yeah.
But what you want to do is use that information then to go into management and address it. Okay.
Mm.
So I think the data gathering here, you did ask a few questions, but then I don't know whether you realize, but there are some question about contraindication you didn't ask, so you had to go back while you were in clinical management asking about clots, lung
Mm.
issues. So that's something you could be more organized to get a clear pass. Okay.
Mm.
Clinical management, I would say that you did explain about the HRT, but I'm not sure which medication we're prescribing because HRT is too vague. So if I had to give you marks for prescribing here, I would struggle to know whether you can prescribe safely. So you have to verbalize, like if it's empty, you take a patch and change it twice a week. I need to
Yeah.
hear it. All right.
Okay. Yeah.
Otherwise, I can't assume you know what you're doing.
Mm.
So for that reason, you probably not get a pass here. You have
Mm.
to verbalize, okay? Um, and also in terms of the numbers, I think you hit her with too many numbers, like
Mm.
23 in a thousand, blah blah blah. Like you don't need to impress examiner. What you need
Mm.
to do is explain it in a way that's really simple and she understands. So for example, I would say something like, it slightly increases your risk of breast cancer, but I would recommend that you self-examine to check if you've got any lumps or any new changes. Get in touch with us. Do you think that's something you can do?
Yeah.
That would be much better.
Sure.
So work on that explanation, and then probably work on linking the psychosocial into the management. As in, I understand you've had some issues with work, but I'm hoping that this HRT treatment with the patch will help you with the flushes, hot flushes. But if you're still struggling getting back in touch, I don't think it's a good idea to say it helps you with cardiovascular health. It sounds very like medical terminology. You should actually use a language. It will help you with the hot flushes. Do you understand what I'm saying?
Yeah, got it. Yes.
So that's part of the relating to other, how you're using your language to relate to the patient based on what they ask you. Okay. Um, any questions?
Yes. No. So in this, I should mention the drug name, like Everal Conti twice change. We should
Absolutely, yeah.
mention the name and okay.
Yeah.
Sure.
So I think you have made good progress in terms of, you used to have a lot of long poses, but that's improved now. So relating to others, I would say because of a lot of jargons, numbers overwhelming the patient, you might not get past here. But if you change the explanation, I think that would work.
Sure, definitely.
Right. So as you can see here, these are things you would consider. And then if, for example, there's also lifestyle things that the patient could do as well. If you have time, you could also add on that. Right, like for example, light fitting clothes when you're sleeping. If you found this video useful, then I'm sure you're going to get a lot from watching this video. Click the video to watch it. Take care, everybody. Bye bye.